Welcome again to another week of Anderson Medicine, where we look behind the scenes in healthcare in the Anderson Township and look at things that you probably wouldn't know about. And we have a couple of characters here today, let me tell you. Lisa Sweeterman, who's the Director of Sports Medicine for Wellington Orthopedics and Sports Medicine, as well as the Director of Community Outreach, and Mike Slimmons, the longtime trainer from 2001 of Anderson High School, but also the Manager of Human Movement. And we're going to find out what that is. But first, let's talk a little bit about some stories. You know, whenever there's a sporting event and there's an injury, you see an army of trainers, physicians come and respond. It's a very coordinated thing. That is the end of a long process. And we're going to talk about that process of sports medicine today. You know, when we think about the Wellington Orthopedics, been here a long time, Anderson Township. We look at Mercy Hospital Anderson, also been here since 1984. A year and a half ago, the two merged. It was about the same time that we culminated the relationship between Wellington and Mercy Anderson and the Forest Hills District. And so I'd like to start with Lisa, talking about the community outreach and what is sports medicine and what we do, and talk a little bit about her. Lisa is a certified athletic trainer. She graduated from Miami University with a BS and a master's degree from University of Cincinnati. She has been an athlete trainer on probably every field, including the professional tennis circuit and a number of other things. She currently manages about 60 of the athletic trainers over 26 or 27 schools. She coordinates the services for those. She currently is adjunct professor at the University of Cincinnati and continues to be an advisory board member for athletic training for a number of universities, including UC and Mount St. Joe. So, Lisa, welcome.
Thank you, Dr. Fagans.
And so can you start about what is sports medicine and what is athletic training? You kind of created this whole network and continue to cultivate it.
Well, we're excited about it. The way I look at sports medicine, the way I explain it is, you know, it's that athletic injury that happens, and we need to get them back on the field, but get them back quickly. And that entails a system of people. Not just the athletic trainers, which we have at our high schools, like Mike Slimmons, but then it entails getting them into a doctor quickly if necessary, making sure the parents are involved in any decision-making processes that have to be made, and then working with physical therapists in the clinic to help get those athletes back quickly but safely.
And so not all injuries are orthopedic. There are many illnesses, including concussions, that are non. So how do you work with orthopedics and the non-orthopedics doctors?
Well, we have a concussion program that we've put in place here in Forest Hills specifically. It's been in place for a while now. We test the athletes before they start with a season, and we do what's called an impact test. It's a computerized test that tests their neurological skills, essentially. And that way we can test the athletes when they're healthy. If they do happen to sustain an injury like a concussion, then we work with our physicians within the city, within this area, to get those athletes seen. And specifically a physician like you, who's a primary care physician with a sports medicine background, because that's important to have those physicians that are non-orthopedic to support those types of injuries as well. And that's just one example. You know, we've got wrestlers who often get skin issues, so we have dermatologists that we work with in the area as well. Obviously, they're still kids. They get strep throat, they get chicken pox, they get those kind of things where orthopedists aren't going to see those. So we've put a system of other specialties in place, primary cares, dermatologists, psychologists, things like that, to support the non-orthopedic injuries as well.
Talking about concussions, you know, I think as we began the partnership, that was a big part of what it's been in the news. It's clearly an issue. Was this district with Wellington one of the first districts to actually start doing baseline impact testing?
It actually was, and they did it on their own before we even came in to support them. This district made a commitment to keep their athletes safe, and they knew that meant not just on the field with the orthopedic injuries, but with the concussion management as well. So they made a commitment long before most of the other districts hopped on to keep those athletes safe.
What does it mean to do like a baseline? So impact was developed by the University of Pittsburgh probably 10 or 15 years ago. It does what no trainer or physician could do. It does what the computer does, which is to the nanosecond response time, spatial, visual, spatial. What's it take about? How long does it take? About 25 minutes to do. Mm-hmm. You get a baseline, and then you have something to compare to. How often do you use the impact test when you're just looking at athletes and stuff, Mike?
Well, we use it once a year for the incoming freshmen. So, and then any other time that there's an injury that's occurred, we'll re-impact test them. So hopefully those are very few and far between, but as incoming freshmen, they'll get tested, and then throughout the year, if they have a concussion situation, they'll get retested for that.
So the baseline testing, what grades does it occur? Like,
we started 7th grade,
Yeah.
and then they're tested every 2 years after that, as long as they stay healthy. And the nice thing about it is it's looking at the individual athlete. So we're looking at what that athlete's healthy baseline was, comparing it to what their post-injury baseline was. So we're not comparing them to a huge national average. We're comparing that athlete to themselves when they were healthy.
Yeah.
And it really is only a tool in the toolbox, though. You know, as a physician, you're going to look at a lot of other things, but what that allows us to do, that impact allows us to do, is to look at that athlete as an individual, not as a group of athletes.
yeah, we kind of like to call it the vital sign.
Right.
What the impact test is, what percentage they're back up to. The other thing we use is something called the ACE, the Acute Concussion Evaluation. It's used by children and a number of other things. It's the other piece of that. There's 22 symptoms that we look at. How often do you end up doing the ACE?
The ACE is invaluable.
Yeah.
I mean, every athlete that has a concussion, they fill out an ACE evaluation, so it allows us to look at a symptom score and get a better idea of where they are. So when we would call you, which you've been gracious to come over and take care of a lot of our athletes, we'd be able to show you the ACE form, and it gives you valuable feedback actually from the athlete, because they're the one filling the form out.
Yeah, when I came here, I came from Wittenberg University, so we're at the Division III level, and I was really impressed with the organization and that you pretty much are ready on the sideline. You guys are, you know, doing evaluation, extremely organized, always on the lookout. So when you're covering, there's one cover defense, one cover offense. I mean, it's very structured, and I know that there's certain times, like I can't talk to you, and other times that I can. I've never quite figured that out.
Well, you know, covering football is all about seeing what's occurring. And so April and I, our relationship is that one of us will take offense and one will take defense. So that just allows us the opportunity to take care of 11 kids versus take care of 22 kids.
Yeah.
So we integrate the athletic trainers from the local universities to help us. So anytime that defense is on the field, myself and a student athletic trainer are taking care of those 11 kids. When they come off the field, we go right to the bench with them and make sure we're not missing anything, and then April's taking care of the offense. So it's a system that works for us, and we just feel like it gives greater value for the kids.
Yeah, it's incredibly organized, and you guys are always looking. There's always eyes on the field. You know, years ago, as a team physician or just some guy standing on the sideline, you just sort of stood there and waited for something to come to you. We actually watch every play. We watch every kid get up, and we've got eyes on the field, eyes on the players. It's a big difference. How has that evolved over the years as a trainer, looking at potential concussions and looking at those kids?
Well, I think the first thing is that we've committed to having more athletic trainers at our schools and more full-time athletic trainers at our schools. When I first started in this position, I started at Turpin High School, and I was there for taping. I would leave for a couple hours, go take classes. Football practice would be going on with no athletic trainer coverage whatsoever. I'd come back later, cover some games, and be done with it. Those days are over. Now, Anderson and Turpin both schools have 2 full-time athletic trainers dedicated to just those high schools. And we have a 5th athletic trainer at Nagel who helps out at the high schools as well. So it's the time, it's the resources, doing things like impact, doing things like combine testing that they did at Anderson last week with the football players. Doing those preventative measures, putting those things in place has been a tremendous help as well.
You know, one of the things that's hugely important is knowing not just what some computer baseline is, but what some is emotional, and because a big part of concussion is emotions change, people's affect change. You don't really know what their baseline is. I'm just so impressed. You know every kid. You really do. You're able to tell in a few seconds, like, this is different or this is not. You mean, how much time do you spend with these guys?
We have the opportunity to be there on a daily basis. So there are kids that unfortunately are there quite a bit. Those are the easy ones to figure out, but it's the ones that you don't spend a lot of time with that you have to get to know a little bit during practice. So those times, particularly during football season, when offense is out and defense is off. That's when you hang out with the kids and joke around a little bit and try to figure out what their personality is and how fast they answer questions and how they respond. And are they a kid that's really jovial all the time, or are they kind of just easy going? Because at that time of that injury, you want to know if that's the kid that's crazy and happy and having fun. He ain't having fun. Mm-hmm. Then we kind of suspect something. So getting to know them is a great point, and we take a lot of pride in doing that.
Yeah. And the key to that, though, is having those athletic trainers who've been at those schools for years.
Yeah.
We don't switch out athletic trainers lightly. So,
it's a great point.
We try to keep those athletic trainers because being part of the community and knowing the community and those athletes is so important.
Yeah. Yesterday we were just at almost a pickup game, and someone got injured who's an Anderson athlete, and they expected to be able to come to the training room this morning. In fact, that's where they were sent, and I think very quickly sent over to Wellington to be able to get some further evaluation. Continue to talk about concussions. Can the helmet get any softer? I mean, can we do anything with building up the helmets, or where are we with this concussion stuff?
Well, I think there's a little bit of a misconception about helmets. Helmets don't prevent concussions. Helmets prevent skull fractures. If you think about the brain as a soft piece of tissue that sits inside a big skull that's hard, and there's a little bit of space in between those two things. And when somebody gets hit, that brain can smash up against that hard skull. No helmet in the world is going to stop that. So there's all kinds of things out there. People talk about mouth guards. They talk about different types of helmets. They talk about adding padding to a helmet. They talk about adding padding to the turf. Quite honestly, there's nothing that's going to prevent a concussion. We can lessen the severity of concussions, but there's no helmet in the world out there that's going to prevent a concussion.
And so the concussion is really the whiplash injury. It's the movement of the head quickly, the stopping suddenly either on the ground or another. A big part of that is building up strength and building up the kind of technique to be able to use, not tackling. What do you guys, how do you work with the coaches on that kind of stuff?
Our coaches in Anderson High School do a fantastic job of teaching that. Take a lot of pride in that. As an athletic trainer, I think our goal is to help just see the things they're not seeing. So there's a volume of kids there, and they don't see everything. So when we're at practice, we're looking for those poor technique issues. And I think a lot of times that's the greatest culprit of it, is they're not 100% sure how they're supposed to manage those things. So as an athletic trainer, we go right to the coach and say, hey, look, this individual doesn't seem to be picking up the concept that you're putting down, so it's prevention from that perspective. I could be wrong, but would you mind taking a look at it for me? And 100% of the time, they're like, sure, not a problem, we'll do that. Thanks for bringing that to our attention.
When we talked about the partnership, one of the things in terms of the money that was provided was to provide for strength and conditioning coaches. How important is that?
Well, I think it's key, and I think that both schools made a commitment to hire well-educated strength and conditioning coaches, and they have put money into their strength and conditioning rooms as well. They continuously educate themselves by going to CEU courses. We offer CEU courses for those strength and conditioning coaches as well. But the commitment to have somebody in a school building all day is important, because they can, just like an athletic trainer, they need to get to know those kids as well. You can't just throw a kid in a weight room and expect them to be able to lift appropriately. And there's so many things to think about with the age of the athlete, the technique of the athlete, the size of the athlete, the sport of the athlete. Having strength and conditioning coaches who understand the sport requirements, the athlete requirements, is critical.
Yeah.
Agree.
We talk about, and we'll finish with concussions here, we talk about the zones. We talk about the first zone after the concussion, return to learn. Our student athletes are students first, athletes second. Student feeds into athletes. So returning to learn. We actually hold them out of the classroom until they're cognitively able to do that. The second is return to just exertion, just to do stuff. You guys work on the bike testing and other things, and then finally return to play. And we pretty rigidly walk through those zones. I mean, we do not release to the next zone without the medical clearance.
Absolutely. I think in the past, I don't think we had enough understanding or value of the zones. I think we missed zone one a lot. We went straight to, well, let's take a break, let's do our impact test, let's rest, we'll go exertion 1, exertion 2, exertion 3, return to practice, return to playing games. Now I think we're really paying attention to zone 1, and I think there were kids that weren't getting better because just going to school after having a concussion or a brain injury is stressful. and kids were not able to move forward. And now I think we pay a lot of attention to that, and that in turn has allowed us to be able to have much more success in Zone 2. So the exertion is much more well tolerated, and the kid's happier and the parents are happier. So I think your zone approach is very precise.
Well, and it does work. And in fact, it's so important that, Lisa, you were asked to speak to the school board about concussions and educate the school board. We've also been asked to talk with teachers so a number of the folks have been in the schools. And what does the school board really want to know about in concussions?
Well, really the effect it is going to have on the student overall, the student athlete overall. The idea that rest cognitively is so important. I think one of the things that we always stress is that a concussion is like a face. There's no two that are different. And counselors and teachers want to be educated on that. They want to understand what the parameters are going to have to be in a classroom, how they might have to change, because they do care about those students. And while they do want to get them on the field, they want them to learn. So it is really important to have that multifaceted approach where the teachers, the parents, the counselors, the coaches are really all on the same page with how we're going to manage that student athlete.
And that's this is one of the few school districts, I think, that in the state that kind of has this whole complete understanding. And I know coaches have come up and said, maybe you need to look at so-and-so. That's impressive when a coach does that. That means that they're working with the trainers, they respect you, and that's going well. So we'll kind of end up with the partnership with the district is not just sports. I know sports are good, but there are other things too that may actually do with the classroom. What other things do?
So we have internships and shadow programs where we can put some of our professionals in the classroom. And in the end, that our professionals love to teach, physicians love to teach, athletic trainers love to teach. We also can bring those kids into our setting as well, especially those kids who are starting to prepare to think about what they want to do for a career. We can bring them into our settings, both in the hospital and the sports medicine side, and really get a picture of what they might want to do or what they might not want to do. Everybody thinks they wants to be a Mike Slemons on the sidelines until they realize how much time and energy it takes. So we give them those opportunities. We also put the mammogram van at the schools and let women come in and be tested in a very easy, very secure manner. We also, the sports medicine aspect is key, but educating the coaches on the sports medicine concepts of concussion management, the Ohio Pupil Activity course. Ohio makes all coaches take a course. We teach that. We teach CPR. So it really is kind of the approach of we're going to take care of the sports medicine, but we're also going to take care of the student as well.
We have the medical explorers and we have the hospital shadows, and I just have to tell you, if there is a student in this district who has any interest in healthcare, from physical therapy to athletic training to neurosurgery, there's an opportunity for you. You got to go and be motivated and ask for it, and there's some ways to do that. But that's absolutely available. So Mike, let's talk. So Mike's a little more than just a trainer. That's a good thing. It's a great thing. But in addition to his incredibly great title of Manager of Human Movement and Strength, Global Movement Assessment, Mike's actually well known for biomechanics. He is a graduate of John Brown University as a trainer in 1990, as a master's degree from the University of Cincinnati Health Science in exercise science. He was a fellow and a graduate fellow of the Gray Institute in applied functional science, and he continues to serve with the Gray Institute as a faculty, and is the biomechanical consultants to some team, some baseball team. The Kansas City Royals. That's a big deal. In fact, Mike, I mean, you actually travel nationally lecturing on biomechanics and kinematics and stuff. So what are the basics of the biomechanics, and more importantly, how'd you get involved with the Kansas City Royals?
Biomechanics is really easy from the perspective of it's just human movement, and every one of us has to move on a daily basis. And it's really cool because the gift of understanding biomechanics has been taught to me on a very simple level, and I'm trying to pass that on to a lot of people within Wellington and in the community and where I teach. And the key to biomechanics is just really understanding that each joint is its own space, whether it's the ankle joint or the knee joint or the hip joint. And when we have come across an injury, an athlete has had an injury, we rehab that joint space, but we also have to be cognizant of what's occurring above and below those joints. And what human movement allows us to do is not just focus on a joint, it allows us to look above and below and find out maybe how those joints might be compensating for that particular area. And so we've gone on and tried to make this evaluation of these people extremely simple. Our athletes, most of the time, function running, cutting, and jumping. So we try to look at these in more functional perspectives and break down each piece of each specific movement, so therefore when they return to sport, they're ready to go. As far as the Kansas City Royals, which I have a lot of pride in that, but the most important thing about that is my dear friend Nick Kinney, who is the head athletic trainer, gave me the opportunity to be able to help be involved with the lower extremity, in particular orthotics. And so for some of the lower extremity injuries, I'll have the opportunity to Skype or get a phone call or have an opportunity to visit in person and look at an athlete and give my opinion. And to be able to do that's a lot of fun. So I appreciate you asking that question.
Well, Nick Kinney's a Cincinnati guy, graduated from
Yes, sir.
Wilmington, was here for some number 6 years or so before he went out there. He's the head trainer of the Kansas City Royals. He's trainer of the year twice.
Correct.
And relies on you. You really do teach biomechanics to the. Are you going to spring training?
No, I'm not going to spring training this
You're
year.
not?
So
Oh.
I wish I was, but I do have the opportunity to teach it and lecture with that around the country, and in a continuing education format. So if an athletic trainer or a physical therapist needs to continue to learn about their profession or have a particular area that they have an expertise or want to grow in, that's the area I get to teach in on a regular basis. So,
Well, Mike's being real humble. I mean, the entire medical staff of Wellington really looks to you for this specific expertise of biomechanics and you know, take it in the spirit in which it's intended. Like, oh yeah, this kid needs Slimmons. And so when kids come to you from all different directions, post-injury, about to have an injury, referred from trainers and physicians. How do you approach, like, okay, here's the knee or the joint, how you start and kind of move with that?
I think you have to begin with the end in mind. I like to look at it global and local. So the athlete is wanting you to pay attention to the local problem, which is their knee joint, let's say. But my initial thing is to make them feel extremely comfortable that we're going to attack that local area, but I'm going global. So I'm going to look at what the ankle joint may or may not do in relationship to running, let's say, or what the hips function may be in running. So the pain might be in the knee, but we're really going to focus on the same side hip and same side ankle joint. And then I think most importantly is to look at the contralateral side of the other leg, the left leg, and focus on those things too. Because a lot of times we miss things because we really stay local, meaning local at that joint or on that side, and forget to look at the opposite side where the culprit would come from. So when we do an evaluation, meaning a global human movement thing, we're looking at it from toes to nose.
Yeah.
And because if they've struggled for a period of time, and I've had an opportunity to spend time with them, I know that there's something we're missing, and that's what I try to go find. So I try to structure that evaluation.
People don't realize just how important core strength, balance, stuff that doesn't come natural are, and that's, there are other programs for that, but and I really appreciate you lecture to the sports medicine fellows. You're part of the fellowship, just like Lisa. I think you're the first lecturer of the year. And so, how do you kind of work with your physicians? As a consultant, as a co-person as well, not just the team physicians, but just the general docs at the Welling and stuff.
I think the most important thing is communication, and with anything, and within the particular sports medicine of Anderson High School and the physical therapy clinic that I work at, direct face-to-face contact is what I prefer. And so if we've had an athlete that's had an injury, I think it's very important that we spend some time with them and make a phone call. So at Anderson High School, in our case, you deal with concussions for us a lot. So if someone had a concussion, we'd evaluate them, we'd pick the phone up and call you, we'd fill out the ACE form and let you know what's going on, and then you would have the opportunity to come over and evaluate that athlete, or you may give us direction how you want to manage that for the next 24 to 48 hours. That goes the same thing from a sports medicine perspective model too. We will get a hold of the team orthopedist or the physician that's in the physical therapy clinic and communicate what we find on a daily basis and make a team approach and give a team answer for that individual.
Yeah, I mean, that's what real sports medicine is, and not all groups do that. It's made very, very clear to the physicians in this group, when that trainer calls, you answer that phone. Unless you're in actual surgery, then not performing and not in it. That
Both.
you that you answer that you take that text. The fellows get that really, really part of, and that's what a true kind of sports medicine. And I really, really appreciate that. Just a couple of there's some high school things that you've done about movement literacy and functional muscle function. What is that?
I appreciate you asking that, Dr. Fagans. That's kind of where my heart is on doing some of those things. Lisa's given me the opportunity to go speak at Walnut Hills High School in the last month, and we spoke to their anatomy and physiology class. And I did 6 different classes. Each class was about 30 kids, and being able to take the anatomical model of muscles, origin, and insertion, and take it beyond the anatomical model of the function, and teaching them what you said was functional muscle function. So we all know how a hamstring, where it comes from and where it attaches to and what it does. But taking that information these kids have memorized in class of where it goes, but then actually giving them the application of it to what happens in walking or what happens in whatever sport they be involved in, that's where the kids go, oh my gosh, this is really cool. Because now they can actually see what the wonderful teachers at Walnut Hills have done, and then understand how that applies on a daily basis. So that for me is a lot of fun, being able to go and teach those kids and take the time to teach them about functional muscle function. And what functional muscle function really is that we have a concept that we are 3D. Every individual is a three-dimensional person, body, mind, spirit, but we also know that muscles function three-dimensionally. And most kids don't know that. And so it's really cool that when they see the anatomical origin and insertions of these muscles, that we can show them that some of the muscles control twisting, and some of the muscles control side-to-side movement, some of the muscles control front-to-back movement. And they're really intuitive. They pick it up really quick. So my job is a lot of times just to go in there and tell them what they already know, but just expand that knowledge level. So I have a lot of fun doing that, and Lisa's really created a great opportunity for me to do that.
Well, Mike, it's just been a real pleasure to talk to you. I know I spend time talking to you when you're able to on the sideline. I mean, you're just a great example of the expertise within the sports medicine local area that is just tremendous. And so thank you for being on here. Lisa, thank you for being on here. Lisa, thank you for managing all these 60, and every one of them is unique, and every one of them has special expertise. And so in the news this week, I just want to do a shout out to a friend. There are about more than 400 volunteers at your hospital, Mercy Anderson, that basically make that hospital work. And we lost one of our own this week, Ted Moats, age 82, died of a stroke last week. Ted was a piano player. If you ever go to Mercy Anderson, you know there's a grand piano. It's a big part of what we are. And Ted played the piano the week before he passed away. Ted is well known. He created an Excel spreadsheet for patient experience. His daughter Sue is one of our chaplains. The Moats family is responsible for the Hope Jars that have been outlined on a number of TV areas and take care and are given to a lot of our cancer patients. And so for a lot of reasons, I just wanted to say thank you to my friend Ted. I will miss you, and your volunteer colleagues will miss you. And so thanks. Another week of Anderson Medicine. Next week, we'll talk more about military medicine with Navy Commander Alan Flanagan, emergency medicine physician who was head of trauma at Kandahar Military Hospital in Afghanistan for a year. And so take care.